So I know that everybody's time is precious nowadays. So why don't I just go ahead and start? I wish we can have a more interactive introduction to each other, but perhaps that might not be feasible given that we have just finite time to schedule for this. So why don't I just give you some sort of a brief introduction of our program, and you can also have a, it's you can have time to ask in questions and answer that way. So why don't I go ahead and start? Can you see my slide and can you hear me okay?
Yes.
Okay, perfect. All right. So good afternoon, everyone. I'm so pleased that you joined us for this information session for T32 program. Before I give you any formal introduction, let me show you a couple of pictures that I often think as sort of a good analogy for our program. So what do you see? Anybody can tell? Any brave soul?
Group work.
It is definitely. Anything jumped out? Okay.
Queen bee.
Yeah, go ahead. Go ahead.
Queen bee and the worker bees around it.
Oh, who was it? Caitlin?
Caitlin, I was the beekeeper.
Oh, wow. I'm so glad. Okay, so at least one person can understand this. You are correct. This is a picture of the bee colony taking care of queen bee larvae. So evidently, that queen bees are not born with it, but it's nurtured by whole colony by giving a fat a special diet, something called loyal jelly. So once they fed for a certain period of time and nurturing through whole colony, they become queen bee. I mean, there was some controversy about theory, but I pretend that I'm subscribing this particular theoretical premise. So I often think that our program, our T30 program, is just like this. Our fellows are the chosen female larva, and we are worker bee and trying to nurture you all fellow to become such a wonderful full scholar, because those queen bee mean to that colony, bee colony, become such a leaders, resourceful protector of colony. We also look for you potential fellows who become queen bee, are the future of nursing science and nursing leader. So that is exactly this program is all about. So you can go home now. Now you learn about this program. So going back to a little more boring part of introduction is that my name is Mi-Young Kim. I direct this program. I also have a number of disparity health equity research projects going on, and have also directs NIH-funded Center for Excellence for Research, what we call TCROS, is a transdisciplinary collaborative research center for supplemental science. It's kind of a mouthful, isn't it? This particular T32 training program is supported by these wonderful senior colleagues in the school. So I co-direct this program with Dr. Dean Typhrogen. Also, we have numbers of preceptors. That coordination of preceptors are always consulted with Dr. Sharon Horner, our Associate Dean for Research. And number of administrative process and sort of executive decision are shared by Executive Council, and particularly supported with Dr. Lin Yu, who is also program research, director of PhD program. So these are very important leaders of our T32 program. And these are the list of our current Queen Bee. These are fabulous researchers who's intimately involved with our program constructions. Since this is such an emerging science, it's not a one person's job to formulating our program. So Dr. Elizabeth Heikemper, who has expertise in data visualization, contributing. Dr. Kabira Rao Krishnan, who is doing an incredible work on digital interventions, also with using innovative series video game method to reach out vulnerable populations and also deliver some personalized intervention, yet scalable intervention. Dr. Ashley Hennigan and Dr. Shirley Kessler, they lead for biological and data scientific area, who's also making a tremendous contribution on data analytics and also for artificial intelligence assisted intervention method, a lot of designing issue. They were very, very important part of this program. Dr. Bozi is well-established informatician. She also helping us enriching our program on the ontological issue and variety of informatics issue that she's very generous mentor that a lot of people, a lot of fellows are getting her help from her during the process. Okay. I want to also mention that this program is not just supported by nursing faculty, but there's a huge numbers of research faculty that across campus. These are the mixture of nursing scientists, and transdisciplinary colleague. I conveniently put about 4 categories, but this categorization is somewhat artificial. I put that because this might be helpful because these are sort of aligning with our core competency. So technology, communication, informatic core, supported by faculties from School of Communications, Health Communications Center, Bell Medical School, iSchool. There's another core that is most substantive area of self-management science and intervention, construction, implementation, and dissemination type of a scientific core. It is also consists of a lot of intervention researchers from our school and also medical school and other school. Characterization of phenotype and genotype of information is a big part of this training. So we have a biomarker epigenetic omics core. They're strong researchers in this core can lend their help from anybody who's studying this area. Also big data analytic and artificial intelligence or machine learning type of technology assist interventions is also we see that as a future precision health intervention. So this core, engineering, computer science, data analytic core, is supported by faculties across the discipline. So when you go to our webpage, you will probably have all these people's portfolio, and you can read and for your future consulting. For those folks who are not selected for this T32 program, you will still use this resource for advancing your dissertations. Like I say, this is funded by National Institute of Nursing Research, and the formal name of this research award is Institutional National Research Service Award. As you know, there is an individual National Research Service Award, which is number called F32, and this is a T32. It's pretty similar program, but this program is actually done by us. Program goal is very clear. We want a future neuroscientist to develop effective personalized intervention that address complex need of self-management for people with multiple chronic conditions. So, so far, nursing science has been doing a great job on delivering a group level intervention and culturally tailoring or contextually tailoring interventions. I believe that future scientists, neuroscientists, have to really work on precise individualized intervention based on information that from individual. So that's the difference between the future directions and current science. And we want to make sure that our fellows will have a future nursing scientific knowledge to be relevant for science in 2020 and beyond. So these are the core competencies that we laid out. So upon completion of this program, we hope that you'll be able to synthesize knowledge applicable to self-management science and precision health intervention methodology. We also put a heavy emphasis on your ability to design innovative self-management intervention with both group level and personalized tailoring methods. So you'll be hearing some new intervention design, something like SMART, like a sequential multiple randomization design, or GDI, just-in-time adaptive design. So those are sort of evolving intervention methodology. But we think that that's very important intervention methodology that you all have to know. I myself is not proficient. I'm just like, one of you, learning, but we have national expertise on this area that we invite for guest lecturer, through classes or consulting, or we plan to have a boot camp. I'll talk about that a little bit later. Another part of competency is understand the molecular basis of health and disease and be able to incorporate omic data into personalized self-management interventions. We understand that as a doctor student, you may not going to be able to have intervention study as your dissertation study, but characterizing right phenotypes, right genotype, just to make sure that your future intervention is going to be more effective and personalized manner. That's perfectly acceptable research topic. But lastly but not least, this is definitely big data analytic area. So we want you to be having some ability to use right, prudent data analytic skill, so enhance personalized intervention, so you can get benefit from a lot of big data, such as EMR generated or a lot of devices, wearable apps produce big data. We are particularly interested in harnessing those data and make sure what would be best intervention strategy that we can deliver to certain groups, certain individual. So there's a lot of creativity involved and a lot of discussions involved. So it's an interesting journey for you signed up for this fellowship. This core competencies acquired through structured coursework. So we have specially prepared 2 courses, 395 and A and B. Maybe the numbers are slightly different now, but it's 3 credit course that deal with the theoretical basis for precision health intervention and also methodological approach, all those different issues related to methodological component of this intervention methodology. So we teach theoretical approach in the fall and more methodological approach in spring. And after that, I think we will definitely going to have more cohorts generating. We will like to plan more active seminar, workshop, discussion group, journal club, so we can really maximize our group learning together. And this institutional environment that is really poised to give you what you need. We have a lot of faculty who's working in that area, so we can sort of refer to you for different lab or different transdisciplinary research environment to make sure that you can learn through that sort of experience. And plus, of course, the personalized mentoring. We just distributed mentoring guide books for fellow and mentor, and our executive leadership committee actually closely monitor the progress of our fellow, especially in regard for the mentoring. So our question is always, these fellows are getting what they need. Is mentoring too much or mentoring too little? What else that we can advise? So this definitely are getting a lot of jelly of our discipline. So as I say, transdisciplinary team project experience is very important. I mentioned about research bootcamp that is planned for each summer. So we are going to have a first research bootcamp this year in August, about one week before the fall semester start. This is designed to have immersion research experience. So introduction of all state of science in each area, data analytics, biological, self-management science, informatics, all that. Plus, they will be planning to have some sort of a statistical software hands-on training will be planned. So this is going to be also very interesting. It's also, I consider this as an incredibly good networking experience. We not only introduce co-faculty from School of Nursing, but also for interdisciplinary colleagues from medical schools, sociology, population center, nutritional department, artificial intelligence, computer and engineering folks. Plus, we invited few national level speakers. So it's going to be very intellectually stimulating workshop. So we are planning to do every year for this, for the fellow. And we are also open this workshop because this is such a rich educational opportunity. So we are also open to other PhD students who are not selected for this program, and also for faculty who would like to learn this new area of science. So besides, getting all this new research knowledge and methodological approach, what are the added benefit of being a fellow of this program? We see that this T32 National Research Service Award is pretty prestigious federally funded training program. It is very nice to have in your resume. It definitely stands out when you have it. When you're into the job market, they tell you that you went through pretty structured specialty training program. Plus, you do have a financial stipend of little over $25,000 per year over 2 calendar years. The second year contract is based on first year satisfactory progression. Plus, you get tuition and also some support, majority support for student health insurance fee. So this is our timeline. Obviously, that the storm last 2 weeks ago was actually messed up our calendar a little bit, but this is roughly what we plan to do. So application due is March 24th, and our website has application portal that you can put that in and get first round review, and people get invited interview April 5th, and all the decisions going to be made by April 9th and April 30, that the selected fellows have to come back with a commitment. Otherwise, we're going to go to the next available candidate. So that's it for me. I just really want to recruit for Inspiring Queen Bee, because this is definitely investment from our part to make sure that we have a good numbers of Queen Bee and nurture, enrich their educational activity. So in return, you're going to become leaders of nursing science. So I'm going to pause here and I'm going to stop sharing. I have a choice. I can go to question and answer session right away, or let me introduce at least a few of my current fellows here, and maybe perhaps that's a good way to. Emily's also joined. Good, good. All three fellows are here. So good, good. So let me introduce you, our current fellow, Eliana. Go ahead and introduce yourself and your area of research and your experience.
So my name's Eliana Gill. I'm a bachelor's to PhD student here, and I'm in my second year. I am focusing on people with cystic fibrosis. It's my population of interest, and my research track is on the symptoms that they experience during a pulmonary exacerbation. In this training program, I was looking at the symptoms and the biomarkers and how the symptoms cluster during pulmonary exacerbations, but by working in this program so far, I've been able to also include some more precision health aspects, such as environmental factors and social factors and their influence on symptoms during pulmonary exacerbations. And I will also want to correlate those with symptom biomarkers and symptom clusters. And so I'm basically just looking at symptoms and their underlying mechanism and how they occur during pulmonary exacerbations and the influencing factors.
Eliana just received another prestigious research funding from Cystic Fibrosis Society. So congratulations.
Thank you.
Okay, Emily.
Hi, nice to meet everyone. I'm Emily Croce. I am a longtime pediatric nurse practitioner for the last 11 years in pediatric dermatology. I am a second year PhD student, and I am focused on access to care for children with eczema with a focus on racial and ethnic disparities.
Excellent. Okay. I thought I saw Kristen. Kristen.
Hi, good afternoon, everyone. My name is Kristen Sinay. I'm a first-year student in the PhD program here in the School of Nursing, and my research interest has been focused on infertility in childbearing age women and how there may be factors related to the gut or vaginal microbiome that influence their fertility status.
Very good. Thank you. Thank you for sharing. Okay, this floor is open to you. So anyone who has a question, raise your hand and I'll call the name. Okay, Kayla.
Hi, yes. Eliana, thanks for kind of talking about how the program advanced your area of research. And by the way, I love your name. That's my daughter's name. But Emily and Kristen, could you speak a little bit about how the program has advanced your area of research in terms of what you want to do?
I would say that the structure of the program just allows for opportunities that I don't think I would have otherwise had for interprofessional collaboration among other disciplines within the university and even beyond. And there's just a lot of opportunity for growth. And with the structure of the program focusing on self-management of multiple chronic conditions, it's sort of helped me as a first-year student sort of plug me into what I was going to look into. I had a general idea of what I was interested in, but the guidelines of the T32 sort of act like bumper rails and kind of help me to narrow down what I was going to look at in terms of multiple chronic conditions and self-management science.
Emily?
Yeah, to piggyback on what Kristen said, I think that there's so many exciting things about being a fellow in the program, but the mentorship opportunities and the courses, which I don't remember if you went into a lot of detail about it, Dr. Kim, but the courses we take and all of the guest lectures that we have and just the constant encouragement, which you have in any PhD program, whether you're in a fellowship or not, but this extra push to really think about your problem from new ways, constant exercises and sort of reframing research questions and figuring out how to create a precision health design for one part of the problem that you're interested in. And then a month later, you're thinking about new ways to conceive of it. And just, I don't know, I think the biggest exercise of the PhD altogether for me has been being comfortable sitting in, not really being sure of what your research questions are and not really sure of how you're going to get there and how it all makes a PhD and a dissertation. But there's just this push to really think about things from new angles. But again, the mentorship is really amazing. I have really incredible mentors within the School of Nursing and then outside of the School of Nursing already. So
Great, thank you all.
Thank you. Any other questions? Good. You guys are all ready to submit your application to webpage? Did you find the application easily from the website? Anybody checked the website?
Yes, it's easy to
Yeah, I
get to.
checked that this morning and it was pretty live. So that was good. Since we have some faculty here, why don't I introduce them? So, you know, they can say some sort of a sales speeches to Dr. Shannon. Sharon?
Hi, I'm the Associate Dean for Research. I hassle Dr. Kim, and this semester I seem to be hassling the students a lot.
Good, good. We have a 1-2 approach. So it's always nice to give instruction by 2 instructors rather than 1 instructor. Dr. Beth Heikemper?
Hi, everyone. I'm Beth Heikemper. I'm an assistant professor at UT. I'm in my 2nd year, and I did my PhD not all that long ago. So I remember being in your position, and I was fortunate enough at my institution to be on 2 different T32s in my, pre-doc experiences. And I can say, number one, I think that the support you get on a T32 is huge. And talking to other people in my cohort, you know, I did feel like I was at a slight advantage because you have a lot of built-in mentorship like all of the current trainees are talking about. It's really a great structure for your experience. And it gives you things like setting the tone for doing your yearly development plans that the NIH requires at an early phase. So it does a lot of really great things for you. And my second point I want to make is that both of those T32s I was on did not have half the structure and half of the wonderful thought behind it that this one does, that Dr. Kim and all the other faculty have put into it. I've been very impressed with the level of support and thought and care that has gone into planning for this training program. So I would urge you all to apply. You know, the worst that could happen is you wouldn't get it, so you might as well do it. And I look forward to working with all of you guys when you're students.
I also want to emphasize that this class is not just for fellow. So anybody who wants to take the classes, it is open to everyone. So, okay, Dr. Bozy.
Hi, everyone. Sorry, I have my dishwasher running in the background, so it might. You hear me okay?
Mm-hmm.
Okay, so I am a professor here in the School of Nursing. I have a joint appointment with the School of Information. My research is at the intersection of aging, health, and information. So I work on developing interventions. Sorry, to help improve older adults' abilities to use computers and the internet to find high-quality health information. So that's a general area. Anything technology related, I'm very interested in terms of finding how technology can be designed and used by people to make a difference. Thank you.
Thank you so much. Dr. Boze is really leading authority on e-health literacy assessment and as well as e-health leaders intervention. So doing a very important work. Dr. Ashley Hannigan.
Hi, can you hear me? Just make sure my monitor's set up right. Hi, I'm Ashley Hennigan. I am an assistant professor at the School of Nursing. And like Beth, I'm fairly new in this role and can very much remember being in your shoes as a student. And unlike Beth, I did one of the individual fellowships through the National Institute of Health, an F31. And while it was very valuable and a good use of time and resources, what you get in a T32 in terms of the cohort and the institutional organization is invaluable. So I'm really excited for you all to have this opportunity and to be part of the faculty that can help bring you along through it. My research is focused on the late and long-term effects of cancer and cancer treatment, and a little bit now on the late effects of COVID in terms of survivorship. And I really take a precision health perspective on understanding why some people have negative effects and others don't, especially as they impact their brain, which is a big data source within individuals. So yeah, if I can help any of you as you either just are joining the PhD program or as you continue through, I would love to do so.
Wonderful. Dr. Kabira Krishnan.
Hi all. Well, I'm very glad to be here. Yeah, I agree with all that has been said. I really envy the students in this program. I think they're getting a lot in terms of mentorship. And I believe it's mutual because I think the faculty, along working with the students, the faculty's scholarships is getting enriched too. And this precision health theme is really influencing all our research and consequently our students. And yeah, so my research is in use of digital gaming to motivate self-management behaviors, digital gaming and wearables to motivate self-management behaviors in heart failure patients. And lately I'm looking at the precision health aspects about how can we use their in vivo data, real world data to influence and motivate behavior changes. So it's pretty exciting. And you know, the faculty are collaborative, the students are collaborative, we share resources here, and you know, we want to be at the cutting edge of what's happening in the science. And I think this program kind of allows that. Is you know, we are at the cutting edge. The kind of information that's being shared in the courses sometimes haven't even been published, and we are trying to bring the best and the greatest and the latest to the students. And that I think is pretty exciting part of this program.
So Kabira and our precision health methodology team just published last year for using digital phenotyping as sort of a strategy for using personalization of intervention. And it was published in Nursing Outlook. Kabira, what was the site? What was the year? Was it
2020?
2020.
Yeah.
And we are also publishing another article. It's titled as Psychosocial Phenotyping of Personalization Strategy for Self-Management Science. So, you know, that Thai Kemper, Kabira Krishnans, and, you know, a few people are co-author on this. So you see that what we're trying to do is we're really trying to define some of new concept in most relevant manner. And we're not waiting for other people to establish the science on it. We are it. We want to pioneer for that particular science. So you will join the, you know, team that has a lot of energy, motivation, and momentum. So this is a very good time. So we have about 20 minutes. I was wondering if this is small enough to group that I can ask for introduction to the faculty for this participant of this information session. I assume that you guys are first year, second year students. So I'll start with the Chanel Wood.
Of course. I'm Chanel Wood. I'm a first year student. I'm still kind of developing my area of interest in my research question. I am mostly interested in dietary behaviors, and I'm leaning towards the emotional and thought aspect of it, like the behavioral side. So I'm not sure if this T32 is really applicable to me. That's why I wanted to come in and check out what y'all had to say.
You might want to make an appointment with Dr. Beth Heikemper. That's exactly the content area that she's studying. The precision nutrition is part of her research portfolio.
Okay, thank you.
Good. Kayla?
Hi, yes, Kayla Longoria. I'm currently a first year student. I was actually one of the alternate entry to PhD. So my background is in clinical psychology, and that's kind of transcended into some of my research interests. So I'm particularly interested in perinatal mental health. And I want to look at like symptom differences specifically and differences in race and ethnicity to eventually dive into interventions that kind of help decrease the symptoms or prevent postpartum depression diagnosis.
Wonderful. Jamie Moore.
Hi, I will be an incoming PhD student in the fall. My background is in community midwifery and elementary bilingual education. And my focus is on, I want my focus to be on the effects of structural racism during the childbearing year and on maternal and fetal outcomes and the epigenetic factors that we could look at to help unpack that and reduce those inequities.
You might want to reading some papers from one of our faculty, Dr. Michelle Wright, her mentor, Jackie Taylor, and her worked on sort of exactly same topic. It's a generational effect of structural racism on maternity outcome and blood pressure. So she might give you some good insight. Welcome. This is wonderful.
Thank you.
Martha Brown.
Hi, I'm Martha, and I will be an incoming PhD student this fall. I just finished my master's degree here at UT, and I focused in on nursing education. My background is in obstetrics also, actually, and I'm interested in something very similar as well, maternal morbidity and mortality, and specifically in Black women and things that we can do to counter that.
Fantastic, fantastic. This is a good time. Just since, I mean, it's not a good thing, but the maternal mortality of African American mother and their experience of prenatal care is just so vastly different. There's a lot of funding and motivation from policymaker to research support organizations to fund some good innovative program. I also do work with not maternal child's my outcome, but I, one of a job related to my community engagement work. I had a grant with a community organization called Mama Sana.
Yes, I've been researching that organization.
Good. So we had a 6-year grant. So I can connect you with that group of people. So you can be. Oh,
yes.
This is we were actually looking for students who were working as a liaison.
Okay.
Us in that group.
Yeah, I was specific. I was researching them because I was specifically interested in the role of like doula care and kind of supportive non-medical structures like that.
Absolutely, they do use a doula care. They also call it maternal justice model. So it's a very interesting model.
Yes, I'm actually taking a reproductive justice course this semester through the Department of Sociology. So that's also really
That's
been...
exactly the model they're looking for. Yeah, good. All right, Angela, Preston.
I would say in the same boat as Chanel. I'm not exactly sure what all opportunities the T32 offers and how well it aligns with my interests. But my background's school nursing and working in the community. And so I'm looking at marginalized adolescents and interested in cultural factors and the role of mentorship and how that can contribute to any marginalized adolescent tapping into their inner strengths. So kind of a positive psychology approach. So still kind of trying to work that out. I'm a first-year student as well.
Are you particularly interested in any high-risk group? Like a sexual minority?
Yeah, so Dr. Rue's my advisor. And so I've had the opportunity to look at sexual minorities with her in research practicum this semester. And then I come from a rural community as well. And so I'm really interested on how those high-risk groups can tap into those strengths and how that will influence their decision to engage in health risk behaviors.
That's pretty cool.
Dr. Kim,
great mentor. Okay, go ahead.
I just want to say to Chanel and to Angela that, I mean, along the lines of precision health, there is so much you can do in both of those areas. It kind of depends on how, like, almost like where your imagination stops. Like just hearing that, I like to think of precision health like in a very basic way of just ways that you can individualize care. And so for both of those people, it's like you take all these extra factors about an individual that separate them from other people and try to help them by using specialized care on who they are as people. So like in my group with people with CF, like the reason I'm starting to incorporate social and environmental factors into like genetics and symptom clusters is that might identify people who are at high risk. And then we might be able to prevent those people from getting pulmonary exacerbations if we can identify them sooner and maybe get them in quicker or round with them more often. And that on its own is individualized precision health care. So I would say that both of the topics you guys have talked about sound like you can definitely work with precision health. I think precision health is a really great way to work with so many different types of information. And I mean, the more people you'll speak to in this program, like there's so many different things you can do. There was a running joke last semester that I'm gonna have to do like 5 postdocs to be able to get enough learning in any of these areas because I'm like, there's not enough time to learn everything. But then again, that's the purpose of continuing to learn in this profession as a doctorally prepared nurse. So I would say that being in precision health, it's more of how limited your imagination is, not what that precision health can't work in it.
Exactly. I want to echo that Eliana's saying. So precision health has no mystery. It is, coming from, we're borrowing that concept from precision medicine. So one of a successful example is precision medicine is coming from oncology, right? You do have some certain genetic genotype that characterize you, finding a good match for particular cancer type, and not, everybody will get same medication, but they will get precise treatment from their own informations, right? Matching with a good, precise treatment for their own individual characteristic of that cancer. We are borrowing that concept for our intervention, our behavioral intervention. So we want to see that not everybody's will be something like digital intervention, right? Not everyone will open to online education interventions. Some people like to have telephones. People like engaging this way and that way. So we're gonna make sure that all those different types, different cluster, we call it as phenotype. Different phenotype exists and they respond to certain intervention differently. So this is just another way of framing your research question. It's not something entirely different. Katie, what is your research topic?
Hi, I'm Katie Trainum. I'm going to be an incoming first year in the program, and I'm currently a labor and delivery nurse. My interests are kind of all over the place still, but I'd say my main interests are adolescent health promotion, and then actually my big one is provider resiliency and nurse burnout. So what interests me about the precision health program is that it feels very actionable way to, I believe, improve provider satisfaction, and that's what makes me excited about it. So
wonderful, great. Tony Chris.
Yes, thank you, Dr. Kim. I apologize for not having my video on.
That's fine.
The internet is not working properly here. But my name is Tony Chris. I'm a second year PhD student in School of Nursing. My background, I have a dual master's degree in epidemiology and environmental health sciences. I worked as a critical care nurse for almost 3 years, and I got to the point where I was the associate manager of the tactical care unit at Parkland Health and Hospital System. I left the role currently, and I serve as the policy advisor on health and environment for the mayor of the city of Dallas. So my interest is pretty much around health disparity in chronic disease prevention, management modalities among Hispanic and non-Hispanic Black adults. And we all know that health disparities exist. So I'm just trying to explore contributing factors that is unique to this population and see what I can do to kind of contribute to the knowledge and move the needle. My goal is to find kind of a structured program like what we have here that will prepare me specifically to be competitive in that discipline and area of research. And I was so glad to hear Dr. Kavira. I was a student of yours before. I still don't know how to pronounce her last name correctly. I apologize. But I was excited for when you talked about the collaboration that happens among the program. And I know that health disparity is issue that is multifactorial, that is always important to consider all the knowledges from different areas of research to make sure that you come up with interventions or program campaigns that will specifically address this topic. I'm interested in the T32 because I think that it will be a great opportunity to grow myself and, kind of create expertise in this line of research.
Wonderful, wonderful, welcome. So it's good. I think we had a successful information sharing session. I heard from you that your research interest. I think that, all of you definitely qualified to apply this. So good luck. I hope to work with all of you soon. Okay, so that ends part of information session, the major part of information session. Anybody has a last minute questions? Very good. Have a wonderful weekend. Bye, everyone.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye.
Thank you.